What exactly is the job description of a podiatrist, and what can they do for someone living with diabetes? Hey everyone, my name is Deidré, and if we're meeting for the first time, welcome to my channel. In this video, you will learn what is podiatry, what is a podiatrist, the role of a podiatrist, how to become a podiatrist, and some of the complications that they treat. If you've previously watched this video or this video, you would have heard me mention briefly the difference between an orthopedic surgeon and a podiatrist. So in this video, we will dive deep into what podiatry is all about, what podiatrists do, and the types of people that they help, including those living with diabetes. First of all, let's define podiatry. Wikipedia says, podiatry, podiatric medicine, foot and ankle surgery is a branch of medicine devoted to the study, diagnosis, medical and surgical treatment of disorders of the foot, ankle, and lower extremity. Let me say, that is absolutely spot on, but I prefer the definition given by Steve Edwards, who is a podiatric surgical registrar from Melbourne, Australia. He says there is no other profession that does dermatology, endocrinology, neurology, rheumatology, general medicine, and surgery all in one day, which is mind-blowing. And to be quite honest, I didn't really think about the profession in that way until I heard him define it so beautifully. Alright, so let's talk about a podiatrist. A podiatrist specializes in the foot and ankle and the lower limb. The aim is to improve the independence, mobility, and quality of life through diagnosis, treatment, and prevention. Mind you, prevention being the operative word. Remember, the feet has to carry the entire body, so prevention is really key to what they do. They treat a variety of conditions such as corns, calluses, ingrowing toenails, heel pain, and other general foot alignment problems. So, if you want to become a podiatrist, for example in the United Kingdom, you will need to graduate from one of the 15 programs being offered across the United Kingdom and Ireland. Once you've graduated, then you can apply to the Healthcare Professionals Council to become a registered podiatrist, and that allows you to practice. Most podiatrists go on to open their own private practice. Some may work in other environments such as community health centers, hospitals, rural settings, or nursing homes, all of which can be quite rewarding and a lot of fun, very interesting, depending on how quickly you want to advance your career. And that's me speaking from personal experience, which we can talk about another time. Or some may go on to start a YouTube channel, like me, which helps me to reach a wider audience, helping people that I won't be able to help if I was in a clinic. Let me know in the comments below if you would like to hear my personal experience. And whilst you're down there, go ahead and give this video a thumbs up. Consider subscribing to the channel. It costs you nothing, but it does help my channel to grow. And hit that notification bell so that you don't miss any of my videos. Some podiatrists remain as a generalist, so for the entire generation of their career, or some may go on to do further study to specialize in areas such as, but not limited to, pediatrics, surgery, sports medicine, or even the diabetic foot. Which brings us to, what can a podiatrist do for someone living with diabetes? Now, looking after the feet of someone living with diabetes is a team effort between the patient and or their carer and a multidisciplinary team of healthcare professionals. When someone is diagnosed with diabetes, a good general practitioner will refer them to a podiatrist. And the reason for that is that a podiatrist is extremely important for your foot health. They are equipped with special tools and knowledge to assess your level of risk for developing diabetic foot complications, such as the loss of protective sensation, so that's peripheral neuropathy, which is the ability to feel pain. If you cannot feel when something is wrong with the foot, then you won't know when to seek help when there's a problem. So let me bring this home for you. Someone develops a diabetic foot ulcer every 1.2 seconds, and every 20 seconds, someone undergoes an amputation because of a diabetic foot ulcer. And guess what? The majority of those cases are usually preventable if only those patients receive diagnosis and treatment early. NHS Digital released a study last year, 2019, that 4% of patients who developed their very first ulcer died within 24 weeks. Some of the other complications that can occur is the lack of blood flow to the foot, also known as peripheral vascular disease, which affects the veins, the lymphatic system, and the arteries. And then you also have peripheral arterial disease, which affects the arteries only. I like to say that diabetes is the mother of all chronic conditions because it affects the entire body. Diabetes affects the small and large blood vessels. So if there's reduced blood flow, it means that if a minor injury was to occur, then you won't heal as quickly as someone who is not living with diabetes, which increases the risk of ulceration and infection, which can progress to the bones and tendon. Now, that person who develops an ulcer is now 9 times more likely to die than have an amputation. Now, let me show you a clip of a man who got very sick to the point where his blood supply was compromised, which led to amputation of all his toes. Diabetes is one of many risk factors for peripheral arterial disease. And if it's not diagnosed early, the same thing could happen to someone living with diabetes. Now, let me warn you, the images that you're about to see are quite graphic, so you may want to skip this section of the video, and I will leave the link for this article in the description below.
I was given the choice by a vascular surgeon that they could either take all my toes off at the feet, or, as he described it, we could let nature take its course. As my hobby used to be walking, hill walking and the like, I decided on the latter. The first toe came off in August of that year. 16 months later, the last one came off. It was a bit of a shock every time, even though I knew it was going to happen. It's just sort of...
Podiatry is a small profession that is continuing to grow because the aging population is living longer, and chronic conditions such as diabetes is more prevalent than ever. In fact, the International Diabetes Federation estimates that by 2030, 33 million people in the Caribbean and 228 million people in Africa will be hit by the disease. I hope you got major value from this video, and I hope that I've helped you to understand the importance of having a podiatrist as part of your healthcare team. And I hope I've also inspired you or a loved one to become a podiatrist. And if that's the case, go ahead and let me know in the comments below and we can continue this conversation. Thank you for watching, and I'll see you next time.